Welcome to First Friday Fertility. I'm Dr. Parry. I am here with the Ladners, the most famous Mississippians, probably for multiples. All right, I'll let you guys introduce yourselves for those.
I'm Haylee Ladner.
And I'm Sean Ladner.
And so tell us a little bit about your story and your journey for things.
So we started coming to Dr. Parry a few years ago to try and get pregnant. I have PCOS, and it was really difficult for us to get pregnant naturally. We had tried for about a year with no success, and so Dr. Parry thought it would be best that we used IUI, which is what we did.
Oral medication
right,
and IUI.
Right, correct. And through that, we actually became pregnant with quintuplets, 4 identical girls and a boy.
Yes. And so, again, to draw upon details that you've already presented elsewhere, you'd had a little bit of a harder journey before. There had been a loss previously. Right. There had also been the fact that you'd done a few rounds.
Right.
And then you only had 2 eggs.
Yes.
This is the thing that many people don't get for things. So 2 eggs, and you say for the long journey to get there is about a 1 in 5 chance with getting you to ovulate. You would have been pregnant that month. And a 1 in 5 chance, some would argue 1 in 10 that both would have taken. So that's where you're talking 1 in 25, 1 in 50 odds to have twins or something like that from that month. But then for one to split into identical quadruplets, what are the odds you've heard on that?
None. I've heard of nothing for that. Honestly, we didn't even think that was a possibility. We never even in our wildest dreams even contemplated that happening. We thought at the most it would be twins.
Right. Well, and the thing is, just for the numbers on that, you usually talk about, if identical twins is about a 1 in, 200 chance, 1 in 100 chance, you can argue the numbers, ballpark for it. You would say 1 in 100 times 1 in 100 times 1 in 100 times 1 in 100. I mean, that is incredibly rare, and a lot of people would put numbers at around the 1 in even 10 million. It's not completely independent probabilities, but if you say, hey, you had a 1 in 50 chance for one thing, and then the 1 in 10 million on top of that, that's pretty unlikely.
Yes.
And so I've seen numbers. In fact, we actually published this case, as you're aware, as the first reported case in the world's literature of twins within one splitting into identical quadruplets. To our knowledge, it hasn't happened before. I would say that's a pretty rare thing.
Very rare.
So there was a set of identical quadruplets, I think over about a decade ago, from around the Tupelo region, which was, again, also discussed and published in incredibly rare. But I think you guys get the record and take the cake.
We take the cake.
We take the cake.
Well, here's the thing, it's a humbling thing. And especially if, something happens so rare, it's publishable. That's also something, that not everyone will experience. For you going from the one side, to the other, worrying, oh my gosh, will I ever get pregnant, to all of a sudden being, nationally recognized and all kinds of things throughout the state. What's the biggest insight you've had on this journey along the way?
It's just such a blessing, I would say. It's just going from not even knowing if I would be able to have one to having 5 perfectly healthy, beautiful babies. It blows my mind every day.
And by the way, it is often so high, people talk for quintuplets often being born before 30 weeks. Tell a little bit about sort of the pregnancy journey, for how everyone watched you closely.
Oh, goodness, yes. So I would say probably a few months in, maybe about 3 or 4 months into my pregnancy, I went on to intermittent bed rest. So I was at home, I was off of work, and I was having to use a wheelchair anytime I would get around. That was to prevent movement, so I wouldn't go into even earlier labor as anticipated. Because we knew they were going to come early, but we didn't want them to come super, super early. We were trying to keep them in as long as possible. And
just to interject, a line that a lot of people use is, and again, I'll defer to neonatologists, maternal fetal medicine, but you say every day inside you is 3 less days in the NICU.
Right.
Everything you did to protect them and have things go as long as you can made a world of difference.
Right. And so also during that time, I was taking supplements, with one baby you want to take prenatals, but I was taking prenatals, I was taking additional folic acid, I was taking a lot of additional supplements to help them with their development along the way as well. And then in January, I actually went into the hospital and was on actual bed rest until I gave birth to them. And I gave birth to them at 28 weeks and 1 day on February the 16th. And all throughout that, the doctors were on call. They had staffs of neonatologists, anesthesiologists, labor and delivery doctors on constant taking call in case I went into active labor early. I had ultrasounds every single day to check on the babies and check on their progress, checking for signs of labor, all of those things. So it was very much, we tried to keep as much control as we could as possible.
Yeah.
In an uncontrollable situation.
Right, incredible one. And that's hard from NICU standpoint and for everything afterwards, but they've done so incredibly well.
They have.
Compared to many who could.
They have. Even in the NICU, our neonatologists, they were great. And our NICU nurses, they would tell us all the time, like, we see one baby, two babies that don't do as well as your babies did. Right. And so for me, too, that's just incredibly humbling to be like, I'm very, very blessed to have these babies. That's incredible that they did so well.
What would you say, being a parent of multiple, changed, motherhood changes everything for everyone. This is fatherhood for things. I'm not, it's sort of like, I always joke, like the hair club for men, they used to say, I'm not only the president, I'm also a client. Getting to the other side for these journeys can completely transform you. What would you say for how you even come together as a couple, for supporting your parents has changed the most from what you expect?
I think we've had to rely on each other a lot more. Even with the pregnancy, I had to rely on him for everything because it was very difficult at the end. I could not even turn over in the bed by myself without assistance. I couldn't get up out of the bed without assistance. And I needed him there for that support. And then after the babies, of course, are born, they were in NICU for over a month. And so that can be, anybody who's been through NICU knows it is difficult to go through, to say the least. It's hard because there are good days and there are bad days. And on those bad days, it's bad day. And so going through that together, we've had to rely on each other, and then bringing them home, we're having to, rely on each other to get them fed, to get them changed, to get them bathed, to just support each other in the good and in the bad.
It's a full-time job taking care of just one child, so 5, definitely a full-time
and
job.
I think one of the wonderful things is you have a great community of great support.
We do.
Which a lot of people, again, in different circumstances couldn't have done nearly as well. And so you've got a story and you transform, others' hopes. For so many people now, again, I would not hope for, if it were to happen, I would hope that everyone did as well as you have. But the complexity would not be what you're usually aiming for or expecting for anyone.
I've had to tell people, I'm like, I don't think that you'll wind up with 5, but I've met so many people who are going through their fertility journey, and it's just, I'm so glad that I can share some inspiration to them, because it's something that I think if you want to be a parent, then you should be a parent.
What do you think for people who are on this journey and are, worried about whether they will ever get there, for the balance between not getting close to being there enough versus having an overabundance, of wealth, so to speak. How do you tell them for that balance?
I mean, it's kind of a hard thing to say, because I don't think you anticipate really I didn't anticipate having 5. It's something I didn't choose. But I would say, it's really hard going through infertility. It's very, very hard. And there can be a lot of times where you just really want to give up. But I don't think that anybody should. I think that if you need a break every now and again, I think that you absolutely should take a break and reevaluate. But I think at the end goal of wanting to be a parent, whether it be to 1 baby or 2 baby, or in our case 5 babies, I think that it's worth it in the end, in any circumstance.
What other advice do you have for everyone watching, learning? And we'll try to post some videos or pictures, later on, intersperse for that, for things. What would be useful to tell everyone?
Enjoy every second you can with your baby or your babies, because they grow so quickly. Mine are 6 months old now, and it seems like overnight.
Definitely overnight, it feels like.
Yeah, it seems like they're about to start crawling and being mobile, and so I want to take everything I can. I don't want to take anything for granted. I want to take everything in.
You guys are blessed and privileged and poster children for, if things can be complex but still beautiful, this is what I love to see. And I couldn't be happier for you guys. We all love you, and everyone was like practically in tears for the episode. Oh, Ladners are coming, awesome, and everyone's really happy. So we're going to go around and talk to them for a bit. So I'm going to put this on pause for a moment. But again, thank you guys for coming and being an inspiration and a source of hope. Okay, welcome back to First Friday Fertility. I'm Dr. Parry.
And I'm Dr. Deadmond.
And we're talking about multiple gestation. Now, we just had the Ladners on again. I think to our knowledge, it was the first published in the literature for quintuplets, where one was including a set of identical quadruplets. It may have happened other times. It may just have never been published, but boy, is it incredibly rare for things. And so, we appreciate their graciousness coming out today. They're going to send some pictures. We'll intersperse them for things, and their kids are really cute. But it is a lot of work. Yeah, they're doing well, and for 6 weeks in the NICU, delivered at 28 and 1, as they had said. That and they almost never go out actually with all of them together. They were talking about this, and they said I could share it. This is one of the things that she was saying I could share, on the journey, that there's so many people who are judgmental about reproduction and saying this is how you should have your family. And first of all, she didn't want to have subfertility. Nobody chooses to have that. The fact she didn't choose to have a 1 in 15 million plus event occur, for all these things, there isn't that control. And so I think we have to really, as a society, come together and be less judgmental on these things. The other thing is, I think that I was struck that they brought up was their sense of humor about it, because they were saying on the way home, they saw this sign for the first time, and it had said up on the sign, "Pregnant?" ? Scared ? And he would say, "Yes." And the fact that they could laugh, and I think this is something for their journey, for the broader fertility journey. It can mold who you become for the better and for the worst, and how you treat each other with dignity and respect ultimately will set a trajectory for the marriage, whether you go closer, whether you get more distant for things. And so I think how they've come together, as well as having good support, they are the poster children for how something complex can go right. And we love them to death, and I'm just so proud and happy for them. But it can go a lot of different ways. With multiple gestation, you see higher rates of prematurity, miscarriage. Well, they were 21, obviously prematurity, extreme prematurity, which is considered below 28 weeks, preterm labor. You look at higher rates of birth defects. You look at higher rates of loss, of postpartum depression, of so many issues.
Blood pressure issues in pregnancy, diabetes in pregnancy.
Malpresentation. Well, again,
yes,
all 4 girls
C-section.
were breech. Yes, they absolutely had that. You can have the placenta in the wrong location for previa. There's only so many places for the placenta to go, and the more real estate is occupied, the more likely that's there for bleeding issues. Atony of the uterus with risk for hysterectomy afterwards. Again, anything that can go wrong in a regular pregnancy can go wrong with a pregnancy that's with fertility. Anything that can be complicated with singleton
Mm-hmm.
is more likely with multiples, possibly with the exception of going late or post-term. But for the most part, a lot can go awry. When
Twins and multiples are cute, but certainly it makes people nervous with all the things we know that can potentially go awry with a complex situation.
Yeah, well, I used to, the last time we did this 2 years ago for things, we called it twins, twice as nice versus double trouble. And I think in that video I'd said I'd never had high order multiples through oral medication and insemination in my career. And honestly, the past 2 years have been a humbling event where we've seen things that are less common for things. So, and this is the thing, you usually talk identical twins, as again, usually in the 0.4 to, sort of 0.4% is a pretty common number that's thrown out there. With IVF, there's some arguments about 0.8 to 1.4 for things. So there's a little bit of debate, but it may be a little bit increased with IVF. They were not, as they said. Again, I'm not going to give any information that is not publicly domain, and that's why the things I brought up with them were also they had previously discussed and are freely available on the web, and so I want to discuss privacy.
We appreciate their sharing of their story with us.
Yes, and everyone who shares. Yeah. Well, here's the thing: when you talk to people about twins, multiple risks, what are the top things you say? Oh my gosh, I'm worried about you for multiples. When do you sort of say that to people?
As far as in moving forward with therapies and things.
Right, is it doing IUIs, doing IVF,
Right, so, at baseline, twins can happen spontaneously without therapies at all. And so we can see that happen just naturally without even treatment. But ultimately, when we're starting treatments to help with ovulation, and we're getting more than one egg in a month, we're looking at potentially increasing the amount of babies that are there. And that would be, risk with having more than 4 eggs typically is the cutoff for where we're looking at things with increasing risk of multiple gestation with oral medications and inseminations. And probably telling you, to sleep in separate bedrooms that week if that's the case. And talking about risks of having a twin or even higher order multiple pregnancy at that point. And with IVF, we are talking about how many embryos are getting put back. With one embryo being put back into the uterus, the risk is much lower than if we're doing more than one. And so that is definitely a factor when we're discussing things for what are the goals for safety and success.
And then again, classically say with single embryos transferring, a little variation, but roughly a 1% chance of identical twinning. The interesting thing, and there was a study, 2018, Dr. Jindal, who's right now, a guru for ASRM for American Society for Reproductive Medicine for the embryology side. She did a great study, 2018, where she actually showed that for twinning with single embryo transfer, it happened about 1.7% of the time. But about 1.5%, it was the same gender, and about 0.15% of the time, it was a different gender. So there were a couple of times where people had these now there's a rare case where it can be Turner syndrome for things, and it didn't really go into that condition where actually it's missing a sex chromosome, and then you could have a boy become a girl. Well, that's misphrased, but ultimately you can have a boy and a girl from the same original DNA, and then as it loses a chromosome, it can shift.
Incredibly rare.
Yes, but has happened for things. But then it's saying that there is so they were estimating that 10 to 20% of twin conceptions with the IVF for single embryo transfer actually there was a superimposed spontaneous conception. They were looking a little more unexplained infertility, some other things like that. There was a case out of Iowa many years ago where a couple, they had PCOS. They had sex the night before the retrieval, and they put one embryo back and ended up with sextuplets. And they basically hadn't gotten every egg in, so they're superimposed. And so it's kind of interesting to see for IVF, if you're doing a fresh transfer, there can be a bit of an increase in multiple rates when you have relations before retrieval, but if you are having a frozen embryo transfer, that doesn't seem to be the case. And so there can be sometimes fertilization of those remaining eggs. So this is why we often talk to people, don't have a reality show, behave yourself the night before retrieval or things like that. And many people feel bloated and don't want to do that. But anyway, that's so the gap between identical versus fraternal for IVF. But again, as we average now as a nation, if you look 10 years ago, average number of embryos was transferred 2.3. Now we're at 1.14 approximately for that. The fewer embryos transferred, the lower the rate for multiples. For IUIs, boy, you can't control it fully, as we just see. And again, we can't account for divine intervention. But what you say as you look for that degree of risk is you're looking at a few things. First, how long has the journey been? If people have never had a chance to have relations, there's pain with intercourse, so they don't have sex. They are a same-sex relationship, doing donor insemination. They are, had a tubal ligation and then a reversal. These are not people you usually want to blow out of the water with a lot of eggs for things. Kate Gosselin, John and Kate +8. She didn't ovulate. My understanding from reading about her history in her book, and it could be wrong, I do not have privy to her medical details, but she had twins with a fertility doctor for her first pregnancy at 26. Then it was an hour-and-a-half commute, went to her generalist. The generalist did an ultrasound, thought she had 3, maybe 4 eggs. She had 5. She actually had septuplets initially, one spontaneously reduced to the sextuplets. But the point was, this was a person who didn't ovulate. So going from 0 eggs to 1 is very different from going to 1 to 2 or 3. She didn't need 7 eggs or 5 eggs or 3 eggs. She needed 1, 2 tops, because this gets into the other thing. She didn't have an opportunity to conceive, and then she did. That's a very different group. So how long you've had an opportunity to conceive. The next thing you're looking at is ultimately the age of the woman. 25, most of your eggs are normal, and you can argue 80, 90%. Numbers vary. But if you're 40, 75% are abnormal. So at 25, you mostly need 1 egg to get a good one. At 40, you need 4 eggs to get a good one. So you can recruit a lot more eggs if the age is increased with less risk for multiples. You also want to say how many eggs did you recruit? And again, you're looking at the age, the duration of subfertility, and whether there are corrected factors, again, as I allude to. And that can give you that algorithm where the less chance they've had, the more you're going from a single egg or maybe 2. Middle of the road is often 2 to 3. As you start getting older, this is in a very long journey where sperm and egg have had a lot of opportunity to conceive without occurring. That's where you can often look at 3 or 4. And over 40, you can sometimes even look at 5 if you can recruit that many. But 5 just always makes me nervous. And this is the other balance. When you talk to people, it's about informed autonomy. I can have all the plans I want for, hey, this is the right balance of safety and success, but you or someone else, they're the one bringing home that child, and there is that really rough balance where I just want to be pregnant. I'm worried it will never occur, and people sometimes want to take more risk than where there's comfort. And I think that if there's doubt, if there is question as to the degree of those balances, talk with a clinician to say, where is my personal equilibrium and comfort zone? And then do as much as you can to find a good balance. Remember, all of this, everything I talk about, we talk about, it's general medical advice. The fact that you're watching a video doesn't constitute a doctor-patient relationship or anything like that. Things have to be individualized, and you can't diagnose over the phone or video or things like that. You have to get to know each other to find that nuance in order to have a clearer direction as to where to head. Definitely consult with a clinician before choosing any plan of therapy. This is food for thought. This is not the meal or diagnosis. Other things that we talk about beyond sort of what are the risks, and by the way, remember for fraternal twins, that even varies among populations. You see, it's for fraternal twins, you can see about 4 in 1,000 in Caucasians, 8 in 1,000 in Japan. Actually, parts of Nigeria, it can be 50 in 1,000, 5% rate of fraternal twins. How many eggs are released? By the way, get this all the time. Does twinning run through the mom or the dad side of the family for things? I was going to put it, it's actually through the mom. It's always how many eggs are released. Whether you have 20 million sperm in the ejaculate or 100 million, there's still only one sperm binding an egg. That's not going to really determine whether there's twinning or not. And so to our knowledge, it's really passed on through the mom's side. So if the dad side has twins in the family, great, but that's not going to affect that particular relationship. But we've talked also about what are the sort of the risks for it, where the prevalence is identical versus fraternal twins. By the way, just for trivia on IVF, if you have IVF, put an embryo back and then have a child 5 years later from that same group of embryos, they are fraternal twins separated by 5 years.
Fraternal twins.
Exactly. So it's kind of cool for that. Beyond those things, I think the other thing, beyond how many eggs you recruit, how many embryos you put back, how you look for people for their own risk profile, really, I think, and also talking about the risks from pregnancy for adverse outcomes with multiples. One thing we didn't address was actually vanishing twin, where again a person can have twins, one that fails to progress and then sort of disappears, and you can still see the risks, not that fully of twins and not fully that of a singleton, but somewhere in between, for increased risk of miscarriage and other things. And it's more common than people realize. You just have to look earlier with the ultrasound. This is also something that needs to be addressed. Anything else on your mind? I think I've, that my tendency to talk a lot, monopolize the conversation. I apologize, I get to that. Anything else we should be addressing for this topic? What do you think people want to hear about beyond?
I think, what are the risk factors as far as if I'm going to do inseminations, what's the likelihood that I'll get twins? And I know that's incredibly individualized, where someone, with 4 eggs developing and both tubes open is much higher risk than someone who potentially has one side where the tube's been removed and the eggs on that side are not likely to be picked up for twins and things like that. But if we're, generalities,
that's a great question. And so I would say you're definitely mindful of which tube is open, which is not, the age of the individual, how long they've gone. For instance, the first insemination, you will probably be a little more cautious than if you get to a 5th, for example, though we had a person, again, when you ask me August of 2021, which, all of a sudden, never had triplets before in my career from oral medication insemination, we've had a few occur since then. You can't control for divine intervention. But I had a person last year, 6th round oral medication insemination using donor sperm, so very expensive. And she said, look, I know I'm going on to IVF. This is probably not going to work, but I'm going to see the 6th one through. She had had a biochemical first or second pregnancy, nothing since. Did the 6th insemination, 3 eggs, in her 30s, all 3 stuck. It is humbling. And so I think you definitely can't predict it, but normally you would say with the 6th round, where often people are looking in a 6, 7, 8% absolute chance of being pregnant at all, for all 3 to take it is less probable. So I think that's on there. The other thing is not only what are the inherent chances for things, and I'm often looking at 2 eggs, let's say a 30 ballpark. 2 eggs, you're often looking at 4 to 6% chance, depending on diagnosis and some variations. 3 eggs, you might be in an 8 to 10% chance of twins, usually 1% or less for triplets. But as you shift those variables, again, duration of time, the receptivity of the uterus or the opening of the tubes, there are a lot of things that can go into the quality of the sperm. What's interesting is if you have lower counts, that can actually improve your pregnancy rates with insemination, which seems counterintuitive. Why would bad sperm help you? Well, if sperm weren't finding the egg and they now can, that improves the odds. But a flip side to all of this is you also have to look at the people where also twins may be greater risk. These are people where they have a history of preterm labor. They have a naturally very short cervix. They have what's called a unicornuate uterus, where the uterus, only half of it ever developed, or a didelphic uterus, where they have 2 uteruses, 2 cervices, 2 vaginas even at times. There are complex variations where some people, or for their inherent health, you know, for instance, this is why over 45, single embryo transfer, you know, you can argue whether it's the mandate, but you certainly lean incredibly heavily towards that. And that's our exceptionally strong preference. You know, you would want to be mindful of who should only get 1 embryo back or aim for 1 egg, recognizing also that fertility is humbling, and you just try to find the balances. And there are people, for instance, the anovulatory, the 0 egg to 1. Well, you've got these people where you've been trying for a month or 2 months, trying to get any egg, and then all of a sudden they finally want to generate an egg, and it's 3. And there is a really difficult conversation on those balances where people feel they've been trying forever and finally have a chance, and then ultimately you're yanking it away. And you don't want to be paternalistic. You want to respect autonomy, but you also don't want to put people at excessive risk. And these are very hard balances, and they're individualized. And it's, you know, you have to give people a degree of respect for going with their preference, even if you might choose something differently. I think that was a lot. That was a
That's pretty good.
great segue. Thank you for that question. I think all of these things, by the way, if you have ideas, if you have topics, let us know. We are always wanting to advance awareness for fertility, for families, helping people make it to the other side. Subscribe, watch, let us know here any other topics you think would be good. And thank you, and good luck on your journey or that for family and anyone else you're supporting for things. So thank you.